We have the world at our fingertips, inspiration in our touch, and power in our hands. Our hands, gentle enough to hold the next generation, yet strong enough to build movements that can change the world. Our hands can build relationships, frame ideas, and empower communities. We have the ability to share and imagine, create and comfort, love and heal the world around us. And it doesn't stop there. Right here, in our hands, we have the power to save a life. If you see a teen or adult suddenly collapse, call 911 and push hard and fast in the center of the chest.
The power is in your hands.
Welcome, and thank you for joining the American Heart Association's Greater Philadelphia Region CPR Awareness Heart Ball Serve Day. The American Heart Association's priority is to build a nation of lifesavers by teaching the life-saving skill of hands-only CPR to at least one person in every household across the country and right here in Greater Philadelphia. And thank you for you guys make a direct impact on this goal by participating in this activity today. Before we get started, I want to take a moment and say thank you to our Heart Ball Serve Day sponsors, Jefferson Health, Infor, Independence Blue Cross, and NFI. Thank you for your amazing support of the mission of the American Heart Association through the Heart of Philadelphia campaign. We are grateful for your support and commitment to giving back. Now, what brings us here today is the American Heart Association's life-saving mission to be a relentless force for a world of longer, healthier lives. This is a mission that we all know is more important now than ever before. First, I want to say thank you to each of you for volunteering your time to learn about hands-only CPR, so you can become part of a nation of lifesavers ready and willing to act in a cardiac emergency. The American Heart Association is dedicated to educating as many people as possible to help save lives. Today is the first volunteer activity provided through the Heart of Philadelphia campaign that is designed to increase awareness about hands-only CPR. Now, the purpose of this presentation is to raise awareness and remove barriers so that people will feel ready and empowered to act in the case of a cardiac emergency. Please understand that this presentation is an awareness activity which does not constitute proficiency in CPR and is not a certificate program. We will be providing additional information for those interested in learning how to become CPR certified and for hands-on practice at a training center following this presentation. And now, let's start our program. On behalf of the Philadelphia American Heart Association team and the board of directors, thank you for taking time out of your busy day to participate in this important event. Serve Day is another way to take the heart ball beyond the ballroom to support our community and contribute to breaking down the barriers to health for all. Now, it is my honor and distinct privilege to introduce one of our most dedicated American Heart Association volunteers in the Greater Philadelphia area. Dr. Helene Glassberg is the Director of Preoperative Cardiac Clinic and Associate Professor of Clinical Medicine at Penn Medicine and the Board President of the Greater Philadelphia Board of Directors. Thank you, Dr. Glassberg.
Thank you, Cicely. Good afternoon, everyone, and thank you so much for joining us today. It is an honor to serve as board president in Greater Philadelphia, especially during this critical moment when not only is the American Heart Association turning the corner to its second century of impact, but in this moment when this mission is more important now than ever. As someone who's attended the Philadelphia Heart Ball many times over the years, I am so thrilled to see initiatives like this highlighted through this critical campaign, truly taking the campaign beyond the ballroom. As was mentioned previously, alongside countless partners and volunteers, the American Heart Association aims to teach the life-saving skill of hands-only CPR to at least one person in every household across the country. And you are making a direct impact on this goal by taking action today. I want to thank you for volunteering your time to learn about hands-only CPR so that you can become part of a nation of lifesavers ready and willing to act in an emergency. More than 350,000 cardiac arrests happen outside of the hospital every year, and 90% of those, sadly, do not survive. And this is not just a statistic. It means that loved ones won't be around for holidays and graduations and weddings. It means missing family and friends at cookouts and birthdays and anniversaries. It means grandchildren won't get to know their grandparents. So cardiac arrest can really break the heart of a whole family. But American Heart Association is hard at work to change these statistics. And these stories, personally, here locally, we were instrumental in the passing of legislation several years ago that made hands-only CPR education a high school graduation requirement in Pennsylvania, following in the footsteps of 38 other states, including New Jersey. That means that every year, millions of young people are graduating high school armed with the skills to save a life. The American Heart Association Greater Philadelphia also works to remove barriers to CPR education by providing training materials to schools, community organizations, and families to ensure that they have what it needs to save more lives. Additionally, thanks to support from Independence Blue Cross, we have a CPR training kiosk at my home place, Penn Medicine. In Greater Philadelphia, kiosks like the one currently housed at Penn have trained over 23,000 people since 2016. And the good news is we have 2 more coming to our region later this fall, thanks to the very generous support from Independence Blue Cross and Jefferson Health. You know, as a cardiologist, I'd like to say why CPR really is meaningful to learn. What I do and at the hospital, we have lots of expensive, fancy technology to save lives, and lots of degrees to save lives. But CPR just requires anyone's 2 hands to save a life. So this really simple measure is really important to me. And I think sadly, you know, it takes a famous football player to collapse on the TV screen for us to understand what this really is. But these are people out there in the backyard, in our homes, on the street. And so on a personal level, you know, I appreciate the Heart Association's investment in taking it to a grassroots level. Thank you again for taking the time to join us today, and I hope you enjoy the program and take this information back to your family, colleagues, and community. I would now like to introduce our Vice President of Community Impact for the Greater Philadelphia region, Jeff Salvatore, who will lead us in our hands-only CPR education.
Thank you, Dr. Glassberg. I appreciate that introduction. As Dr. Glassberg said, I am the Vice President of Community Impact for the American Heart Association Greater Philadelphia region. I've been with the organization for about a year, but prior to that, for the last 11 years, and still currently, I have worked as a cardiac ICU critical care nurse. So at the American Heart Association, we always like to share our why. So professionally, this is very important to me because I've had to deal with a lot of loved ones of patients who feel like they are bearing the guilt and the reason why their loved one passed away because they just called 911 and didn't do anything to intervene. And that seems like a tremendous amount of guilt to have to deal with for the rest of your life. So trying to prevent others from experiencing that. But personally, I'm a cardiac patient myself. So I have an electrical heart problem called prolonged QT syndrome, which means I live at an increased risk for experiencing cardiac arrest. And I can guarantee you that if I ever go down around you and you do not do CPR, I will haunt you for the rest of your life. So I'm here to make sure that you do not get haunted by me. All right, so today we're going to be going over hands-only CPR, and we're going to be touching subjects such as the difference between cardiac arrest and a heart attack, what actually is hands-only CPR, when to call for 911, what do you do while you're waiting for EMS to arrive, what is an AED, and ways to take action in an emergency. We're going to be addressing common questions, and then we'll have a few call to actions at the end of the presentation. And if there's time, we will answer some questions. Next slide. So cardiac arrest is when the heart stops beating. I always like to preface this by going over the main job of the heart. And a lot of people is to say, well, it's to pump blood, but really the main job of the heart is to pump oxygenated blood. That oxygenated blood is really important because the whole reason why, it's so important to continue doing compressions during a cardiac arrest is to make sure that that oxygenation is continuing to circulate throughout the body to prevent end organ damage, primarily any death from occurring in the brain. So when someone does recover, it's a meaningful recovery. So cardiac arrest is triggered by an electrical malfunction, meaning there is no pumping action going on in the heart. 7 out of 10 cardiac arrests occur at the home or at a residence. Next slide, please. So I always like to differentiate the difference between a heart attack and a cardiac arrest, and I think this is a great visual and that's helping to do that. So remember, in cardiology, you can have two problems. You can have a plumbing problem or you can have an electrical problem. So a heart attack is that plumbing problem. It's a circulation problem. The arteries that supply the blood flow to the heart to be able to do its job of pumping that oxygenated blood, if they get clogged up between plaque or other things that are occurring within that bloodstream that stop that blood from occurring, that can cause a heart attack. Now, a heart attack can put strain on the heart that leads to a cardiac arrest. However, not all cardiac arrests are caused by a heart attack. So remember that a heart attack is a plumbing problem. It means there's an issue with the circulation, and a cardiac arrest is an electrical problem, meaning that there is no action going on. There's no pumping action going on within the heart. Next slide, please. So what exactly is CPR? So back in the 1740s, the Paris Academy of Sciences recommended mouth-to-mouth breathing for drowning victims. In the 1960s, that changed to CPR, which stands for cardiopulmonary resuscitation. The American Heart Association gave it a huge facelift, and we started going in and acquainting physicians with closed chest compressions in cardiac arrest victims. So basically, CPR is when you take over as an external force and you take over that heart's job of pumping that oxygenated blood throughout the body. Next slide, please. The American Heart Association recommends hands-only CPR for teens and adults who suddenly collapse. So this is not applicable to infants and children. We still do recommend rescue breathing with infants and children, but in the setting of teens and adults, hands-only CPR is efficient, as evidenced by research from the American Heart Association. Next slide, please. So I always like to speak to the difference between hands-only CPR and CPR training and certification. So certification comes with more in-depth training. It includes not only first aid, but also rescue breathing in the setting of a cardiac arrest. And hands-only CPR, though, is a campaign that the American Heart Association created to really combat our bystander response rates. So in the nation, our CPR bystander response rates are only 40%. In the greater Philadelphia region, they're even lower at around 23 to 26%. So that means over 60% of the time in our area, if someone sees somebody's collapse or they're down, they call 911 and they don't do any interventions. We know that by increasing that bystander response rate, we're ultimately going to be increasing cardiac survival outcomes. And not only outcomes, but I always like to add in here, we want to make sure that it's a meaningful outcome. By you calling 911 and doing chest compressions right away, it's going to lessen the chance for any death to occur to that brain. And it's going to increase the chance that someone's not only survives cardiac arrest, but they make a meaningful recovery. And that means that they're able to have the same quality of life that they had before the event. Sometimes if someone cardiac arrest and CPR is started a couple minutes late or CPR is provided, but it's not high quality and efficient, there may be damage that occurs to the brain that makes people end up being on either a ventilator for the rest of their life, or they have to have a feeding tube. And that's not really a high quality of life. So we want to make sure that we're not only increasing the survival rates, but increasing the survival rates that have a quality, meaningful of life as well. Next slide, please. So I'm going to show this image a few times throughout my presentation. It's because I really wanted the takeaway message to be that hands-only CPR is number one, without mouth-to-mouth breathing, and it's number two, it's only 2 steps. The first being you call 911, and the second being you push hard and fast in the center of the chest. I know many people heard the ABCs of survival growing up, which is airway, breathing, and circulation. I myself was always taught that. I'm sorry to break it to you that that is old and outdated evidence. And by no means I am calling you old. I'm just saying that the evidence and the research is old. The latest research shows that the order of importance is actually CAB. So circulation is our main priority. And then it's airway, and then it's breathing. So first and foremost, in the setting of a cardiac arrest, we have to make sure that there's always being that oxygenated blood circulating throughout the body. Now, I know many people are asking, well, why not rescue breathing? Isn't that important? And there's 2 different reasons why we came up with the hands-only CPR campaign. So first and foremost, evidence shows that there is enough oxygen not only within the blood, within the lungs, but within the blood to be circulated through to sustain the victim until EMS takes over to provide that advanced airway support. Another reason why hands-only CPR is so helpful is because it's going to help in that combat to increase those bystander response rates. I do not blame people who do not want to put their mouths on a strange victim. Before the pandemic, not many people were too excited to do that. And post-pandemic, we're not even recommending that you put your mouth on a victim unless you have a breathing barrier due to transmission of disease. So with the knowledge that the 2 steps are only calling 911 and doing chest compressions and not having to do rescue breathing on someone, we're also hoping that that will help to increase those bystander response rates. Next slide, please. As I had mentioned earlier, 70% of cardiac arrest happen outside of the hospital, and Dr. Glassberg had spoke to that over 350,000 cardiac arrests occur each year. So this means that if you ever have to do CPR on somebody, it's very likely that it's going to be someone you know and or a loved one or family member. So it's really important that we are equipped with the tools to be able to make sure that we're providing our loved ones with the best chance for survival that we can. Next slide, please. So this image depicts what we call our outside hospital of cardiac arrest chain of survival. It's a very long title, but it is a really great image. As you can see, the first 3 steps, which is recognition and activation of the emergency response system, immediate high quality CPR, and rapid defibrillation, all can be and should be done by a layperson. You do not have to be a medical professional, and you do not have to have a certification to do either of these 3 steps. As I always like to say, you do not have to be certified to save a life. So first, we are calling 911, and the reason that we're doing that is for different response rates. We know that sometimes it can take a little bit longer for EMS to get to the scene. The perfect example of this chain of survival working successfully was last year when Damar Hamlin cardiac arrested on Monday Night Football on national television. The EMS was contacted right away. He received immediate high quality CPR as soon as he went down on the field, and he also received rapid defibrillation. Could you go to the next slide, please? Unfortunately, a really poor example and outcome of that chain of survival not working and there being a lapse in it was 2 weeks later in Newark, New Jersey. There was a 12-year-old boy named Elijah Brown who collapsed at football practice. They did call 911, however, nobody knew and or attempted CPR. It took EMS over 35 minutes to arrive on the scene, and unfortunately, Elijah Brown passed away. So we know that lack of CPR training is a health equity issue. In the greater Philadelphia region, Black and Hispanic adults are 41% less likely to receive bystander CPR in public and 26% less likely to receive bystander CPR at home. In addition, women across the board, regardless of race, are substantially less likely to receive bystander CPR than men. So not only is it important to educate to these statistics and these facts, but empower and equip the people in these communities who are disproportionately impacted by cardiovascular disease and cardiac arrest to be able to give themselves and their loved ones the best chance of survival, and for us to help our neighbor as well. Next slide, please. Once again, just reiterating the 2 steps: call 911, push hard and fast in the center of the chest. So first, when we see somebody go down, we always want to check for responsiveness. Some people may say you want to check to see if they're breathing, check to see if they have a pulse, and all those answers are correct if you are certified and have received that extensive training. However, if you are not a certified individual, the American Heart Association only recommends that you check for responsiveness. So in the setting of someone being down, you first make sure the scene is safe. You want to run up to them as long as the scene is safe, keeping yourself safe as well, and check for responsiveness by screaming very loud in their face. You can, try to shake them if you want. A tactic that I like to use is what's called the sternum chest rub. We use it in the hospital a lot. And it's where you place your knuckles in the middle of the chest on the breastbone and push as hard as you can. It's a very sensitive area. It's a pain point, and the person, if they are alive, will have some kind of response. However, once we deem that the person is unresponsive, we are going to pull out our phones and call 911 and place it on speaker, and then immediately initiate high quality CPR. Next slide, please. So when you call 911, they're going to ask you questions about the emergency, such as, was the collapsed witnessed? Did you witness it, or did you stumble upon the person being down? You're going to provide as much detailed education and information to them as you can. They will also ask you about your location, where you are, some kind of marker that the EMS can look for as they arrive upon the scene. Know that while you're speaking this whole time, please have the phone on speaker and be starting that CPR. And most 911 dispatchers should also be speaking you through the steps of doing CPR as well, and communicating those steps through the phone to help you provide that high quality CPR. Answering the dispatcher's questions is not going to delay the arrival of help. If anything, it's going to make the arrival appear sooner and have the best outcome for survival by talking you through the steps of CPR. Next slide, please. So when you do begin to do CPR, you want to always make sure that first the victim is on a hard surface. I cannot emphasize this enough. I've had several patients over the years who unfortunately had a cardiac arrest while they were sleeping. So they were either on the bed, in the bed, or on a couch, and their spouse, partner, loved one, whoever was around, tried doing CPR to them, on a soft surface. You want to visualize when we're doing CPR, we're using the bony prominence of the sternum and the bony prominence of the spine, and we're pushing them together so that they compress the heart to push that blood throughout the body. So if you are not on a hard surface, that compression is not going to happen, which means that the blood that's in those chambers of the heart is not going to be getting pushed out of the body. So please, please, please always make sure that the patient is on a hard surface. I've received questions of, what if the person that I share a bed with is a lot larger in size than me? Or what if, they're nervous to pull them off the bed in case they're hurting them? I want to emphasize that if someone is experiencing a cardiac arrest, they are currently not alive. So anything that you do is just going to help their chance of survival. So do not be afraid of bumping their head or dragging them onto the floor, because that is going to give them the best chance of survival. If you think that somebody who may be laying in bed, that's someone that you live with or a family member, you're concerned about your ability to be able to actually get them off the bed or off of a couch, you want to identify a hard surface that you can put underneath them to at least help with those compressions if you aren't able to get them off of that soft surface. So something such as a cookie baking sheet or something else that you might be able to identify under in your house, you want to just put under them before you begin doing that CPR. Next slide, please. You want to make sure that you place the wheel of your hand or the base of your palm on the sternum of that person's chest. So put the base of your palm in there with hands open, interlock your other fingers over top as shown in the pictures, and that is the position that you want your hands in, right in the center of the chest. It does not matter if you are right-handed or left-handed, which hand you put down first. This is solely a comfort level. I myself have done CPR with both my right and left hand down. If I'm in a long code situation, I'm usually switching hands because your wrist can get uncomfortable as it is. So that is not important. What you just want to make sure is that the hand that you put down first, the base of that palm is on the sternum, and you interlock the other hand over top. You can see in the picture next to it, you always want to make sure that your shoulders are over the victim. And this is for two different reasons. So first, you want to make sure that that's going to help you be in the center of the chest and help you with your positioning. And then secondly, it's going to help your body weight to do some of the work for you. CPR is an extremely laborious activity. You're going to get physically exerted extremely quickly. So using that body weight is going to help you work smarter and not harder, and help you sustain doing effective, high quality compressions for a longer amount of time. Next slide, please. The next thing that you want to be sure to do is that you're doing compressions at a rate of 100 to 120 beats per minute. Now, this is so important to be in between that sweet spot, because I had mentioned earlier, the whole point of doing CPR is to take over for that heart's job of pumping that oxygenated blood out throughout the rest of the body. When you begin, a lot of times our adrenaline is pumping, and as soon as you begin to do CPR, you're going extremely fast. You're going over 120 beats per minute. This is not a good thing to do because, like I said, it's a very laborious process. By going quicker than 120 beats per minute, you're just going to tire yourself out even quicker, or even more quick, sorry. And then secondly, if you go over 120 beats, the whole point of doing CPR, as I keep mentioning and keep bringing up, is pumping that oxygenated blood out throughout the body. If you go over 120 beats per minute, you're not allowing the chambers of the heart to adequately fill with blood. Therefore, you're not going to be pumping enough oxygenated blood out throughout the rest of the body. So it's really null and void. And likewise, if you go under 100 beats per minute, the chambers of the heart might be filling up with blood, but you're not circulating it through quick enough to prevent any end organ damage from occurring. So it's really important that you're between that sweet spot of 100 to 120. Now, you may be asking yourself, how do I know what that sweet spot is? Next slide, please. And this is why we encourage you to be the beat, find the beat, and keep the beat. So the American Heart Association has a playlist that has songs within that 100 to 120 beats per minute range. And we just ask that you pick one of those songs and you keep that in your head and you do compressions to the beat of that song during a cardiac emergency. Our most iconic and most ironic song is Staying Alive by the Bee Gees. It has the perfect beat between that sweet spot of 100 to 120. And some other honorable mentions that I always like to bring up are Crazy in Love by Beyonce, because Beyonce is the queen. Eye of the Tiger, which is very Philly related. Ain't Nobody by Shaka Khan is always a fan favorite when I'm doing these hands-only CPR demonstrations. I Want to Dance with Somebody by Whitney Houston, and More Than a Feeling by Boston. Some other ones right off the top of my head that we play a lot is More Than a Feeling from the Trolls movie. I know if you're parents, I'm sure your kids have watched the Trolls movies a lot. So More Than a Feeling is a popular one. Poker Face by Lady Gaga is another one. So there's a lot of good songs and everybody can find one that they like. So make sure that you have the song ready to go in your head and you are doing compressions to the beat of that song. Next slide, please. Now, the next stop in that chain of survival is the third one is rapid defibrillation. And that is used by an AED, which stands for an automated external defibrillator. These are lightweight portable devices and they deliver an electrical shock throughout the chest to the heart. So AEDs, they typically have signage around them when they are posted on a wall. There is also an app called AED Pulse Point that you can look up where the closest AED is to you in a location. The only caveat with that is the AED has to be registered to that app. So I encourage you in your workplace, in the centers that you frequent, in your personal life, whether it's community organizations or gyms or things such of that nature, you want to check in with management or security and make sure that those AEDs are registered to Pulse Point AED because it'll help people in the setting of an emergency to find the closest AED. Next slide, please. So although AEDs may all look different based off of the make and manufacturer, they all function completely the same. The one biggest takeaway that I want you to leave with here today when it comes to an AED is that all you have to do is turn it on and follow the instructions. As soon as you turn on an AED, it's going to walk you through step by step every single thing that you do, every action. You don't have to remember what you have to do because the AED will give you clear and concise directions on how to utilize it. In addition to audio prompts, there are visual prompts all over the AED, the pad packets and the pad themselves for those who are hearing impaired. So there'll only ever be two buttons on an AED. First is the power button, and then the second is the button that you would deliver the shock with. How AEDs work is once you turn it on and apply the pads, they will prompt you to clear the patient. And the reason that we clear the patient is because the AED has to interpret that rhythm. So as I mentioned earlier, cardiac arrest is when there is no pumping action of the heart. So sometimes though, there is an electrical system is going haywire, which means there's pulseless electrical activity. In Damar Hamlin's case, when he cardiac arrested, he was in a rhythm called ventricular fibrillation. So in the heart, there's a whole chain of command when it comes to giving directions. It's kind of like a whisper down the lane thing, telling each part of the heart what to do and when to pump and contract. It starts up at the SA node and it works its way down. In the setting of a pulseless electrical activity, like ventricular fibrillation, it means the electrical system is going haywire. It's not speaking properly. Everything's just speaking out of turn, which in return, there's no pumping action going on. So when we place these pads on the victim, the first one being on the right side of the chest and the other one being on the left underarm area, that first pad, the right pad up on the right chest, is like the pitcher in baseball. It throws out that electrical shock, and the bottom pad on the left side is like the catcher. It's catching it, and right in between its path is the heart. And the hope behind that electrical therapy is that it shocks the heart into communicating properly again to start working. Now, something to remember is that if you are prompted by the AED to deliver a shock, as soon as it says shock delivered, you want to immediately resume CPR. We do not have advanced monitoring in the fields without EMS there. We do not know what the rhythm is, and oftentimes people require more than one shot. In Damar Hamlin's case, he required a shock on the field, in the ambulance, and once he got to the emergency room as well. So we don't know that if the heart is communicating properly and pumping again, but what we do know is that we have to circulate that oxygenated blood through, right? Remember that CAB, compressions, airway, breathing. So as soon as a shock is delivered, please continue with the compressions. And then 2 or 3 minutes later, the AED will prompt you again to clear the patient to analyze the rhythm to see if they require another shock. A lot of times people ask me, if I'm by myself in an emergency situation, should I leave the victim to go find an AED? And a lot of people put such an important emphasis on using AEDs. And yes, AEDs really do increase the chance of survival if they are able to be utilized. However, and I like I just mentioned, and I will reiterate, compressions, that circulation is first and foremost what we have to do in the state of emergency. So to help further explain, in that ventricular fibrillation rhythm, instead of the heart contracting, you want to think about a bowl of Jell-O, and there's red Jell-O in the bowl, and that represents the blood. And instead of that bowl contracting and pushing that Jell-O out, it's just quivering, it's fibrillating, it's going back and forth. So the blood is staying in that ventricle, in that chamber, and it's not pushing out. So even if you get the AED and deliver a shock, but then that heart's not contracting, that blood's still not going anywhere. So if somebody is in a rhythm that requires a defibrillation, however, we don't have access to one, doing adequate compressions will sustain them and be able for them to have a meaningful outcome in survival by just doing compressions alone until EMS takes over. So that is everything with compressions and AED. And before I do a quick demonstration, we're going to answer some frequently asked questions. And then at the end, we will offer time for questions for people in the chat. So next slide. One of the first things that we get asked all the time and reasons why our bystander response rates are so low is that people are nervous of receiving legal ramifications for trying to help. So in the state of Pennsylvania and in many other states in the United States, you are covered by the Good Samaritan law, which means if you act in good faith to administer emergency care at the scene of an emergency, you are not liable in civil damages. So I would like to stop right here and just pinpoint, a lot of people are nervous that if they do CPR, that they will break somebody's bones, break somebody's ribs. We work with survivors a lot of times of cardiac arrest to help advance our mission and educate on our work. And 2 survivors that come to mind are Stephanie Austin and Amy Cavalieri. They were both young moms when they experienced their cardiac arrest, and they speak to all the time how thankful they were to wake up with their broken ribs, because the broken ribs were the reason that they were able to not only wake up, have a meaningful recovery, and continue to see their children grow and live today. When you are doing high quality, effective CPR, it is common for ribs to break. So please do not let that deter you from administering CPR in the setting of an emergency. Likewise, another reason I mentioned earlier about women being substantially less likely to receive bystander CPR is that people are afraid for kind of sexual harassment lawsuits. So something that we're doing is not only educating this, but the American Heart Association is also manufacturing mannequins that have the female anatomy to not only let people practice doing CPR on someone who has female anatomy, but make them comfortable with hand placement and things such of that nature. Next slide, please. The question is, can I make things worse, such as breaking somebody's ribs? And I know I mentioned this earlier in the presentation, but I would just like to say again that someone who is undergoing and experiencing a cardiac arrest is not alive. So no, you cannot make things worse. You can only help. We know that, doing CPR and doing compressions is not always going to make for a survival and a meaningful outcome. But what we do know is that cardiac arrest without intervention is 100% fatal. So you can only help to make things better for that victim who's experiencing a cardiac arrest. Next slide, please. If I have no formal training other than participating in volunteer activity, what if I do it wrong? So without CPR, as I had mentioned before, it is 100% fatal in that situation. So you can only help. So you have to remember those 2 steps of calling 911, putting your hands in the center of the chest, and pushing hard and fast. So you can see here, I have this inflatable mannequin. And really quick, I would just like to speak to what we do on the community impact side of things is we really work to implement sustainable interventions around CPR education, training, and awareness in the communities who experience the worst rates of cardiovascular disease and cardiac health. So one thing we do is we have these kits that they come with a pump, they get inflated really quickly, and they have mechanisms inside there that when you get to that depth of 2 inches when doing CPR, you'll hear that click. So this gives you great practice on how much effort and energy you have to put into doing effective CPR. So as I mentioned earlier, you put the base of your palm right in the center of the chest. You can see on these mannequins that there is a little oval there that represents the sternum, which is where you want to put the base of that palm. So you always want to be to the side of the patient or the victim. Put that base of your palm in the center of the chest, interlock your hand over top. Make sure you're leaning forward so you're working smarter and not harder. So you're sustaining your ability to do effective CPR longer. And then you just push hard and fast in the center of the chest until EMS arrives. And I'm going to do this for 10 seconds so you get an idea of what that looks like. And you'll hear the click every time, meaning I'm going at a depth 2 inches. So a lot of times, I know I'm standing up right now, but a lot of times you will be kneeling down next to the person. You always want to make sure that you have them on a hard surface, like I had mentioned, which is most ideal is the floor. So you will technically, most of the time, be on your knees, kneeling next to them, but it's the same action, making sure that you're leaning forward. So final takeaway is remember the 2 steps. I know I've said this multiple times, and I'm going to say it again. Call 911, push hard and fast in the center of the chest. Next slide, please. So we just have a few call to actions on what you can do to make a difference. So first and foremost, taking charge of your health is always number one. You want to know signs of a heart attack, what to look for in yourself, what to look for in your family members and friends and loved ones, what a cardiac arrest looks like, and how you can intervene. Please make sure you have a primary care provider. If you don't, please schedule a visit today. It's so important to know your numbers, know your blood levels, know your blood pressure, because untreated cardiovascular disease are all things that are going to lead to your risk for experiencing a cardiac arrest. And lastly, living a healthier life by trying to eat healthy and incorporate exercise into your weekly activities. Next slide. So number 2, what you can do is brush up on your skills. We have the AHA Knowledge Booster app, and this provides free CPR and first aid models for you to always keep this at the front of your mind and stay up to date on the latest evidence and research from the American Heart Association when it comes to cardiopulmonary resuscitation. Next slide.
If you see a teen or adult suddenly collapse, it is important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to ask someone to call 911 and to get an AED, or call 911 yourself and put your phone on speaker mode so the operator can assist you. Then get directly over the victim. Put the heel of one hand in the center of the chest and put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push giving 100 to 120 compressions per minute, which is about the same tempo as the song Staying Alive, or the rate of music you're listening to right now. Let's hope you never have to use hands-only CPR. But know that CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. Again, if you see a teen or adult suddenly collapse, don't be afraid to start hands-only CPR. Remember, call 911 and ask someone to get an AED. Then push hard and fast in the center of the chest until the AED and help arrives. Your actions can help save a life.
Spread the word. That is a 90-second video that really goes over everything that I've been speaking to. And as we had said earlier, we want at least one person in every household to know the life-saving skill of hands-only CPR. So we will send this link as a follow-up, and please make sure that you share it with your family members, your friends, your coworkers. If you have social media, you can post it to that. It's as simple as just clicking copy, paste, post, and getting that word out. Next slide. You know, a big aim of the American Heart Association is to advance policy that advances cardiovascular health outcomes for all, and your voice matters. So you can text mission to 46839 to join today to help us in our efforts to advance those policies that are going to help save lives. Currently, Damar Hamlin is helping us back up a bill that would require AEDs to be a part of all youth sports organizations. So please join today, or you're the cure. And then next slide, we have additional ways to be a CPR volunteer. One thing that you can do is if you're interested in learning more or becoming certified, you can look up the closest certifying training center near you and volunteer and sign up. However, other ways you can be involved is, as I had mentioned, we work with communities to place these resources where the health outcomes are the worst. So behind me, you can see the CPR in Schools training kit. We have a lot of collaborations with the school districts in the city of Philadelphia, with youth sports centers and other areas all around the greater Philadelphia region to place these kits so people are able to have sustainable practice and education around hands-only CPR. So you can work with your organization or just yourself to help place those in areas that we deem need. Also, we have individual CPR Anytime kits that just are a single box that you can purchase and have in your household to teach this with your family members. And then next slide, I believe, is the questions. There we go. So we can open up the chat, and if anybody has any questions, please feel free to drop them in there.
Thank you so much, Jeff. As we draw this virtual meeting to a close, I'd like to say thank you so much to Jeff for his incredible presentation. And if anyone has any questions, we'd love to answer them for you. Or accolades for Jeff.
Thank you, everybody.
Oh, there is a good question. Tracy
Yes.
asked, this is a great question. You see it if you take off your
take off
shirt?
their shirt? That's a great question. So if you have access to an AED to utilize, you can take off their shirt because you want to make sure that the pads are flush against their skin. Sometimes people will just kind of like pull it down and place the pad there and lift it up and place it. But if it's easier to take the shirt off, then yes, you can do that. Just please try to maintain, the integrity of the person the best that you can. How do you know when to stop doing the compressions, or do you continue until EMS arrives? That is a great question. And yes, once you start doing compressions, you do not stop them unless you're prompted by the AED until EMS arrives. So even, the only time you want to stop is those 10 to 15 seconds that the AED is analyzing the rhythm.
I see a question. I'm sorry, this is Cicely. I see a quick question around DNR. Victoria has a question around DNR. Victoria, if you would like to come off your mic, you can ask that question.
So the one thing I will say, if you might not come off mic, is DNR stands for do not resuscitate. And it's hard to know in a public setting if somebody is a DNR. That's more so a lot of the times in a healthcare setting, a hospital setting, for professionals to not intervene if they do cardiac arrest. That covers you under the Good Samaritan law, that if you do CPR on somebody in a setting of emergency in public, that you can't face legal ramifications if they are a DNR. How do you know when to stop doing compression? Oh, we already asked that question. When you do the AED a second time, how long in between? So the AED, they're all manufactured to every 2 to 3 minutes. They will prompt you to clear the patient so they can reanalyze, and it's going to have audio prompts to tell you when to get off the patient, so you don't have to know when to do that. The app that we recommend you sharing, give me 1 second here, is called the American Heart Association Knowledge Booster app. And if someone could drop that in the chat for them, thank you. It doesn't matter what side of the patient we are on. No, it does not. You just want to make sure you're on the right or left. Sometimes, since these mannequins are so small, people will be at the end of them, and I'm always like, oh, so you're sitting on the patient when you're doing CPR, but you want to make sure that you're on the left or the right side of them. I couldn't come off mute. I hope I answered your question, Victoria. If I didn't, drop another message in there and I'll try to answer it the best. What is the minimum age where hands-only CPR should be used, aka no mouth breathing? Great question. So the minimum age we say is teens and adults. So that's anywhere around that, kind of 12, 13-year range where you can do hands-only CPR. What is the general guidance for kids under the minimum age? So for infants and for children, it's still that rate of 100 to 120 beats per minute. The only thing that changes is the depth that you go and providing rescue breathing. If it is a family member doing breathing in their mouth, will it help them more? So yes, it will help them more, but I'm glad you brought this up because a lot of times people were spending so much time and emphasis on doing the rescue breathing that they would keep checking, am I doing the rescue breathing right? Do I see chest rise? Do I not? That they're taking away from doing compressions. And as I had mentioned before, you only want to ever stop CPR, those compressions, for no more than 10 to 15 seconds. And people were taking up to 45 seconds figuring out if they were doing breathing right. So unless you are certified and trained in providing rescue breathing, you do not want to do that because you're interrupting the circulation of that oxygenated blood flow. And it's going to, unfortunately, not help the patient or that victim out even more. So always remember CAB, circulation, airway, breathing. I'm still not certain where to place my palms. So you want to do it right in the center of the chest. So there's always that breastbone you can feel on people. You want to put the base of your palm right on the best breastbone in the center of their chest. All right. If there's not any other questions, I appreciate you all so much for, taking the time to be with us today to hear about this. And if you do have any questions, feel free to shoot us an email and I'll do my best to answer them in the future.
Thanks, Jeff, so much. I really appreciate your time and your demonstration. And I'd like to express my deepest gratitude to you for this invaluable demonstration of hands-only CPR. And your expertise and willingness to share this life-saving knowledge with us has truly been remarkable. So again, thank you very much. I hope that each of you has taken away something valuable from today's session. And learning the basics of CPR is not just a skill, but a potential lifesaver in critical situations. We trust that you now have the confidence to step up and make a difference should you ever find yourself in a scenario where bystander CPR is needed. Before we wrap up, I'd like to share a video from our 2024 Heart of Philadelphia Heart Ball Chair, Dr. Joseph Cachone, CEO of Jefferson Health. This video not only highlights the incredible work that the American Heart Association is doing, but also reinforces the significance of skills that we've demonstrated today. So without further ado, actually with a little further ado, I'm seeing some of the questions, and yes, we will be sending out a link to the video, and any of the other questions that were asked, I will try to include those in the link as well, and I will drop my email in the chat so that you can email me directly. So without further ado, let's take a moment to watch the video that Dr. Cachone has prepared for us. We believe it will serve as an inspiring reminder of the impact we can all have on the lives of others. Thank you so much for your time and dedication today, and please enjoy the video.
Good afternoon. I'm Dr. Joe Cachone, Chief Executive Officer of Thomas Jefferson University and Jefferson Health. I have the distinct honor of serving as the chair for the 2024 Philadelphia Heart Ball. 2024 is significant as it marks 100 years of the American Heart Association's relentless work to save and improve lives through scientific research, clinical guidelines, community-based interventions, education, and advocacy for public health policies in communities across our country. Looking back over the last 100 years, these bold moves have helped transform our nation's healthcare, reduce heart disease and stroke death rates, and improve the quality of life for heart and stroke survivors. However, those gains have not been shared equitably. Many people have suffered and died disproportionately based on race or simply the zip code they live in. These long-time disparities were magnified and even worsened by the COVID-19 pandemic. In the United States, we are experiencing the highest single-year increase in cardiovascular-related deaths since 2015. The American Heart Association stands ready. In this moment, it's critical that we recognize and redouble the life-saving progress we've made in nearly a half-century of researching, advocating, educating, while identifying and removing those barriers that still put certain people disproportionately at increased risk for cardiovascular disease. Success over a century has prepared us for this moment. With bold hearts and powered by millions of supporters and volunteers, we forge ahead into our second century of life-saving work. The focus of the American Heart Association Philadelphia team is to increase the rate of bystanders administering CPR and AED in the event of sudden cardiac arrest. While the national rate of bystander CPR is approximately 40%, here in Philadelphia it's only 23 to 26%. When a person has a cardiac arrest, survival depends on immediately receiving CPR from someone nearby. According to the American Heart Association, about 90% of people who suffer out-of-hospital cardiac arrest die. CPR, especially if performed immediately, can double or even triple an arrest victim's chance of survival. At Jefferson Health, we have made a significant commitment alongside the American Heart Association to place a CPR mobile kiosk in the Philadelphia community. This kiosk will remove barriers to access for CPR and AED education and train thousands in Philadelphia in these life-saving skills. I am proud of this commitment and the impact it will make, and I thank each of you for joining us today to take the time alongside your colleagues and friends to learn these life-saving skills yourself. You never know when you may be called upon in the event of a cardiac emergency. More lifesavers in the community will mean more lives saved. Before we end, I want to extend a special invitation to each of you. Please mark your calendars when the American Heart Association will be celebrating its Centennial Heart Ball here in Philadelphia, a celebration of the American Heart Association's transformative impact over the past century and its ambitious goals to build a second century of equitable health for all.
Once again, we want to thank the American Heart Association's 2024 Heart of Philadelphia Heart Ball sponsors, and thank all of you for your participation and commitment to making a positive difference in our community. Please mark your calendars for the 2024 Heart of Philadelphia Heart Ball on Saturday, March 23rd, 2024. We look forward to joining many of you by celebrating our impact in the ballroom. Thank you for your continued collaboration. Together, we can make our communities healthier and become a nation of lifesavers. Wishing you all a wonderful rest of your day. Thank you so much.